Hello, everybody. Thank you for joining us tonight. I'm here with Dr. Elena Ivanina. And thank you for attending our first SIBO Insights Chasing a Diagnosis webinar. My name is Paige Betts, and I'm with Gemelli Biotech. We are the makers of TrioSmart and IBS Smart. We specialize in diagnostic tools for GI conditions and aim to educate and empower the patient population. We are very excited today to have Dr. Elena Ivanina here to talk to you about SIBO and how to test for it using our TrioSmart breath test. Dr. Ivanina is a renowned quadruple boarded gastroenterologist with extensive experience in diagnosing and treating SIBO. She is also a leading researcher in gut health, contributing valuable insights to the medical community. So without further ado, I'll have Dr. Ivanina take it from here.
Thank you, Paige. Thank you so much for having me this evening. I'm really looking forward to talking today at this live webinar about SIBO insights. And I think everyone is going to get a ton of interesting information out of this. So let's get started. Okay, so this is me. Hi, I'm Dr. Ivanina. Basically everything Paige said, nothing new here. I practice mostly in New York City, and I really do focus on breaking down the IBS diagnosis, which in a lot of cases comes down to SIBO. So tonight's agenda, so you know what you are in for. So we're going to talk about understanding SIBO, EMO, and ISO. Those are acronyms that we are going to break down, so everyone is hip to the lingo. Diagnostic challenges and connections to other gut issues. As we know, the gut and gut health is connected to so many other processes in the body. So we're going to talk about that. A deep dive into the TrioSmart at-home breath test, discussing treatment options, diet, lifestyle strategies. We're going to do some Q&A questions. Some really great questions came in. And then a webinar giveaway and promo codes. So very exciting agenda for this evening. So let's start with understanding SIBO, EMO, and ISO. So what is SIBO? The definition of SIBO, small intestinal bacterial overgrowth, is defined as the presence of excessive bacteria in the small intestine. So this overgrowth significantly disrupts the normal balance in the gut microbiome. And so the symptoms that are often accompanying SIBO is bloating, distension, abdominal pain, gas, diarrhea, and constipation. Now, what is EMO? So the definition of intestinal methanogen overgrowth, or EMO, is an overgrowth of methane-producing archaea, right? This is not bacteria like we were just talking about in SIBO. This is archaea in the small, but also large intestines. So this condition was previously considered methane SIBO. And the symptoms: constipation, bloating and distension, abdominal pain, gas, and yes, even sometimes diarrhea. And now this is the new kid on the block and a really exciting addition to the overgrowth subtypes is ISO. So the definition is intestinal sulfide overproduction, or the overproduction of hydrogen sulfide that's caused by an overgrowth of hydrogen sulfide producing bacteria in the small and the large intestines. So this condition was previously considered hydrogen sulfide dominant SIBO, but now, as you see, they all have their own definition. And so here the symptoms really, come down to severe diarrhea, bloating, distension, abdominal pain, and gas. So this is a really nice slide to put that all together. So again, these are the three types of overgrowth, right? So there's no longer one or two, there are three types of overgrowth. We have SIBO, that's hydrogen overgrowth. Most commonly, there is bloating and diarrhea. We have EMO, that is methane overgrowth. Most commonly, that's bloating and constipation. And we have ISO, which is hydrogen sulfide overproduction. And that is bloating and severe diarrhea. And this is a really helpful slide that I think perhaps some of you have seen. It's from Dr. Mark Pimentel, one of the leading researchers in SIBO and the other types of overgrowth. So this chart really breaks down the different types of overgrowth, and we'll go through them, the mechanism, location, phenotype, and again, what microbes are responsible. So starting with methane. So interestingly, smooth muscle contractility effects, right? So there have been studies showing that it actually decreases transit. It decreases motility, right? Reduction in transit. So this here, the phenotype is constipation and bloating, right? It slows things down, and it can be either in the small bowel or the colon, right? We call it EMO. And again, very interesting is that it's not typical bacteria, right? These are archaea. These are things like Methanobrevibacter smithii. So a very important distinction. Now, the next type, hydrogen, right, or SIBO, this is kind of our classic SIBO. This one has been around the longest. And so in this one, you have hyperfermentation, right? You have your bacteria, they are fermenting and producing so much gas, right? Leading to bloating, diarrhea, right? Immune response. We know the microbiome and your immune system are like this. They are so interconnected. So there's this immune response that happens. There's a promotion of hydrogen sulfide gas. There's barrier dysfunction, right? We know leaky gut or intestinal permeability is a huge part of, gut conditions. And we'll talk a little bit about that later, but there's barrier dysfunction and visceral hyperalgesia. Visceral hyperalgesia is really that your gut is feeling more than it should, right? You're feeling more than normal. And so again, this is in the small bowel, colon. It's called SIBO, usually diarrhea, bloating, and very commonly E. coli and Klebsiella pneumonia. And finally, again, there's ISO, which is our hydrogen sulfide overproduction. And this is really fascinating in that it is associated with mitochondrial dysfunction. I'm sure everyone here has heard about mitochondria. They're kind of like our energy powerhouses on a very cellular level. And so this is a really important fact to know, and the fact that it also influences visceral hyperalgesia. So visceral, again, visceral is the gut. It's the organ, and that it's feeling more than it should. So again, ISO, more severe diarrhea and bloating. And, this is probably the newest research is that the gut microbes responsible are Proteus mirabilis desulfovibrio fusobacterium. So the diagnostic challenge and connections to other gut issues. So you can see here that SIBO is really associated with many other conditions that are also associated with each other because, as Hippocrates once said, basically all disease starts in the gut, and the gut is connected with everything that goes on in your body. It's like the microbiome is like that middleman. So the SIBO connections that we know about are, of course, IBS and IBD. There are studies that say over 50% of people with IBS get diagnosed with SIBO. IBD, also very common, celiac disease, diabetes, pancreatitis, often chronic pancreatitis, Hashimoto's thyroiditis, right? That is an autoimmune condition, fatty liver, leaky gut, as we talked about already, the concept of intestinal permeability, but increased intestinal permeability. So when you have your gut, you have the tube, the lumen inside is the microbiome, then you have a mucus layer, then you have the barrier. And then beyond the barrier, you have the systemic connections to the blood, right, through vasculature, through vessels, and to the immune system. So the idea is if there is a dysbiosis, which I'm sure people might have heard this word. What does it mean? It isn't basically an imbalance in your microbiome like SIBO, then it can influence leaky gut. And again, having that abnormal connection between what's in the gut and what's in the wall of the gut. So really, really fascinating research coming out here. And scleroderma, of course, scleroderma is an autoimmune condition that affects the gut and slows the entire gut down. But within your digestive tract, a delicate balance exists between beneficial and harmful bacteria. So you don't really want to say this bacteria is always good, this bacteria is always bad. You have to think about having the right balance of bacteria in your gut. So what if I previously tested negative for SIBO, but still think I might have it? So people may have been tested for SIBO with breath tests for years, but it's only within the past 3 years that Trio Smart has actually released at the 3-gas breath test. So if some of the things I have talked about sound like you, the bloating, the change in the bowel movements, the issue of your gut being more sensitive and feeling more than it used to, if those things sound really familiar, then, again, and you have tested for SIBO and were negative, but perhaps that was only the 2-gas breath test. So again, Trio Smart is the only test that actually has all 3 gases. So when high levels of hydrogen sulfide are present, levels of hydrogen may appear lower, leading to a false negative on an outdated 2-gas breath test. So this is something that we talked about a lot. We knew, through some of the research that was coming out that there was going to be this test for ISO. And we knew, from research coming out that there was this idea of we called it flatlining or lower levels of hydrogen that could be associated with something else going on. So even if you had that 2-gas breath test and it was negative, again, it might have missed out on ISO. So introducing the Trio Smart 3-gas breath test. So you can see this is what the box looks like. It is a at-home test, which is so convenient. You don't have to spend, 2+ hours in someone else's office. Instead, you can do it in the comfort of your own home. So it's trusted by over 100,000 patients. It's a lot of patients. Trio Smart is the #1 CLIA certified mail-in breath test and the only at-home 3-gas breath test on the market, right? It's verified, right? It's done in a lab. It's associated with an academic center. So sometimes people come see me and they bring some SIBO test that I have never heard of. And to try to tell me they have SIBO or don't have SIBO. And I don't trust the results if it's not from a validated center. So again, CLIA certified. It's 20 times more sensitive. Again, #1 CLIA certified, only 3-gas test. So fact check, Trio Smart is the only breath test that gives you the complete picture of your gut health. Because as you also probably noticed, sometimes there is, some overlap between the symptoms. For example, hydrogen could have constipation, sometimes have diarrhea. So you need to make sure you have all 3 types tested to make sure you understand if you have an overgrowth in your gut or not. And so again, Trio Smart tests for 3 fermented gases. That's looking at hydrogen, kind of the classic SIBO, methane, EMO, and hydrogen sulfide, now ISO. A lot of people want to know if it's going to be covered by insurance. And that's, of course, a really important point that we wanted to address here, right? Are you interested in verifying if your insurance covers Trio Smart? So Trio Smart is covered, at least in part, by many common insurance plans. So to inquire about coverage with your insurance provider, you basically can take a snapshot of this information. So you'll need the CPT code, which is 91065. You have to bill it twice, so your provider can help you with that. And you need a specific NPI number of the test, 137-600-6932. There you go. That's what you need. And please note that Medicare and Medicaid may not cover the telehealth services. So just important to be a very well-informed consumer and know and talk to your insurance. So let's get into the test prep, right? So if you actually go to triosmartbreath.com, there's a SIBO quiz to see if taking a breath test is a good idea for you. And this is really useful. I've had a lot of good feedback about this from my patients, that there's a scheduling calculator that helps with timing your preparation for the test, right? So you've got the quiz, and then you've got the calendar where you put in the date that you're going to take it, and it gives you a really nice, thorough plan of when you have to stop a certain medication, your diet, all things we're going to talk about right now. So prepare for your sample collection, right? The North American Consensus on Breath Testing. This is kind of like our academic consensus. So this is very driven by evidence, which is great. It's how you want to do your testing. So it recommends the following preparation before doing the test and collecting the samples. So number one, if you are taking antibiotics, you need to tell your provider. In general, the most common advice will be wait 1 month. As you can imagine, antibiotics take a toll on your microbiome. So your results may not be completely accurate if you have just taken a course of antibiotics. So antibiotics, really important to note. If tolerated, pro-motility drugs and laxatives should be stopped at least 7 days prior to sample collection. So this is if tolerated. So you should really have a individualized discussion with your doctor. It does not mean every single thing that you take to support your bowel movements has to be stopped at least 7 days before. You can come up with basically a good schedule with your doctor, keeping in mind why we do this, right? You do not want to do the test on laxatives, on prokinetics, or something that moves your gut forward, because the results are not they're not readable in the same way. So now again, as long as they're out of your system, so you don't take the substrate, glucose or lactulose, and have like a, more significant reaction, again, you can talk to your provider about a good schedule for you. A restricted diet, this is so important. You need your gut and your microbiome to rest the day before. You need to quiet things down, right? So I think this is an easy thing to remember. It's meat, tofu, eggs, potatoes, white rice. So if it's not on that list, you don't eat it. A lot of patients are like, well, what about, what about that chocolate after dinner? No, if it's not on the list, it's only one day. You just stick to this list, and, limit your seasoning just to oil, salt, and pepper. Simple, right? And in general, most people actually feel better on this diet. So especially if you do have SIBO, you might have a day of rest from symptoms. And in addition, right, so water, of course, and then if you're doing coffee and tea, totally fine, but no additives, no milk, nothing, right? You really want to stick to this to get an accurate test. Do not eat or drink anything other than what's listed here, and no fruits or vegetables the day before the test, right? Because that wakes up your microbiome and it becomes active, it ferments the food, and that does not create a valid test, an accurate test. And so again, after you do the restricted diet the day before, then overnight, you're going to fast 8 to 12 hours. And then in the morning, you're not going to eat or drink, right? And especially during sample collection, except for 1 cup of water with lactulose, right? If you're doing it with lactose, or if you're doing it with glucose. And of course, a couple sips of water is fine. Okay, so let's get into the nitty-gritty of actually doing the test. So you're going to get that box that we looked at. So what is inside, right? So you're going to have a plastic bag, right? That's where you put everything. You're going to have 9 breath collection bags. They have these little white valves. 9 sticker labels for you to fill out and attach the bags, right? So you want to make sure you keep everything super organized. You have 1 mouthpiece that attaches the valves on the bags, and 1 requisition form, of course, to fill out all your information, and then a prepaid shipping label to return the kit. Easy. So again, what do you do? Step 1, this is all, of course, all these directions are going to be in your kit. So it's something to, in advance, just take a look at and, get comfortable with, but it's very simple and easy to follow these directions, right? So step 1, prepare, apply the sticker label, right? So you put your sticker labels, sample number, collection time, date, name, birth. Then you attach it, right, to a deflated sample collection bag, right? Once you blow, they're going to be inflated. So before you blow them, so label them all. Then you attach the mouthpiece and open the valve, right? So it fits snugly. There's a small hole. This should be facing up. These are very important details. And then you turn the cap on the valve counterclockwise until it is fully in the open position. So again, all these instructions come with the kit. And then you collect your breath sample, right? So you can see there, you take a deep breath and then you exhale. So it's the exhale, right? You exhale continuously into the mouthpiece, and air will escape from the hole on the top of the mouthpiece, right? After 2 seconds, while continuing to exhale, you cover the hole with your finger, and then you're going to see that bag inflate. So only exhale once into each collection bag. And then step 4, close the valve and remove the mouthpiece. So close the cap by turning it clockwise until it's fully in the closed position. You see it says open closed, and remove the mouthpiece from the valve. And that's it. So then you're going to actually have the sugar substrate drink, right? So that can be either glucose or lactulose. And so just very important to remember, you've got your baseline test before you drink the sugar substrate. So collect your first breath sample, and then you're going to drink the lactulose or glucose, right? Only after the first sample. You have to wait 15 minutes before collecting the next sample. So if it's lactulose, which is a prescription, you just have 1 dose, 10 grams of lactulose in a 15 milliliter solution. It's about a tablespoon. That's very important. 1 tablespoon, not a lot. With or followed by 1 cup of water, right? And discard any excess. And if you were prescribed glucose, you drink the full 75-gram dose of the glucose solution provided in your kit. And then step 6 is keep going, collect your remaining samples, right? So you basically repeat step 1 to 4 for each remaining bag to collect 8 more breath samples. Wait 15 minutes between the collection of each breath sample. And then confirm, of course, each bag is completed at the time of collection and it's properly applied to each bag. So, ta-da, you're done, you completed your test. So now you ship it, you put all of the air-filled sample collection bags into the plastic bag, you seal it tight, you place the plastic bag with your requisition form and your insurance card inside the Trio Smart box, and then you put the prepaid shipping label over the original shipping label and close the box and drop your kit off at an appropriate shipping facility as listed on your shipping label. And so definitely do it within 24 hours, right? Or the next business day if you're doing the test over the weekend. And you actually get results within 7 business days after your sample is received. And I don't know if any of you have done any other functional medicine testing, or any other testing can take weeks. So the fact that this takes 7 business days is so quick. And of course, yeah, keep your tracking number if you want to track the shipping progress. Okay, so let's talk about the results. So again, how long does it take to receive the results? Within 2 to 5 days of when the lab receives your samples, you will get an email with a link to log in and access your results. And what does it look like? Well, it's going to be delivered via email. You have numerical values, a graph, and they're going to be characterized as normal or abnormal, right? So if any of your values fall into a borderline range, please refer to the methodology section for guidance that you can share with your healthcare provider. So here it is. This is what it looks like, right? So on the right is the main first page, and then you have the graphs on the second page. So here's an example. So on the top, you have this first chart where it tells you normal or abnormal. And then you can read the methodology, and then you go down to the interpretation. So it will tell you, is it indicative of SIBO, indicative of EMO, indicative of ISO? And then you can actually break it down, right? So by interval, with 0 being your baseline T1 sample, and then you go forward by timing, right? 23 minutes, 40 minutes, 57 minutes. And so, of course, we can then interpret every single test and understand which is positive and which is normal. So how do we understand what is normal? Everyone sees this result. How do I know if it's normal or not, right? So for hydrogen, SIBO, so hydrogen levels are considered abnormal when they rise greater than 20 parts per million from the baseline, right? So just like we saw in that graph, the first one, that's your baseline times 0. And then you look to see if you rise greater than or equal to 20 within 90 minutes. After 90 minutes, we assume that it probably got to the colon, and it's okay if it's much higher later. But within 90 minutes is key, right? So normal levels of hydrogen are indicative of small intestinal bacterial overgrowth. That is SIBO. Then we've got methane. Methane levels are considered abnormal if they reach over 10 parts per million at any point during the breath test, any point. So this is not a change. This is, you look at that methane number. If it's ever 10 or over, then you are positive. So abnormal levels of methane are indicative of intestinal methanogen overgrowth, EMO. And now our final Trio Smart measuring hydrogen sulfide, right? So hydrogen sulfide levels are considered abnormal if they reach greater than or equal to 3 parts per million at any point during the breath test, right? Just like with methane, it's anytime. Abnormal levels of hydrogen sulfide are indicative of intestinal sulfide overproduction, or ISO. A lot of people have taken this test, and I can tell you it can really change your gut healing journey and give you answers. It's a beautiful thing. So here's some really nice patient testimonials. Your test identified issue that I've had been misdiagnosed for over 20 years. I hear this all the time. People have walked around with IBS with no real plan, and finally you get this test and you get an answer and you get a plan and you get better. Trio Smart changed my life, right? You can move forward and begin your journey. Your kit is by far the best one with instructions and prep, not to mention support we'll talk about. And my Trio Smart results helped my dietitian. I come up with a very specific treatment plan that's very effective. So it was the first time that person started to feel better for the first time in over 5 years. You hear the story all the time. So let's talk about treatment options, dietary and lifestyle strategies. So antibiotics, right? So for SIBO, EMO, and ISO treatment, there are different antibiotic, either monotherapy one or combination therapy that has been shown to be helpful. So the ACG clinical guideline for SIBO suggests the use of antibiotics in symptomatic patients to eradicate overgrowth resolved symptoms, right? And so it's really rifaximin, as you can see here, right? So the antibiotic rifaximin was seen in subjects with IBS symptoms with abnormal hydrogen levels. So that's for SIBO. Then you've got EMO, so ACG, which is the American College of Gastroenterology, our kind of academic our power that kind of helps steer our clinical decisions, right? So ACG clinical guidelines for SIBO suggest that EMO treatment may require more than one antimicrobial agent. So patients who received a combination of rifaximin and neomycin showed a higher rate of methane eradication compared to just receiving one of them alone. And then for ISO, data shows treatment of patients with bismuth subsalicylate produced an over 95% reduction in fecal hydrogen sulfide release, right? And there's also strong evidence that antibiotics like rifaximin can be effective in the reduction of correlating IBS-D symptoms like the diarrhea. So rifaximin seems to be kind of a base, and then there is dual therapy that appears to be better for EMO and ISO. Okay, low FODMAP diet. I'm sure some of you have heard about this diet. So this is developed by Monash University in Australia. And this diet helps up to 75% of people with IBS during the elimination phase. So for those of you who might not have jumped into this yet, FODMAPs stand for, right, fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. So what are they? This group of FODMAPs are fermentable carbohydrates, right? So your gut bacteria are fermenting the unabsorbed carbs into gas. So, for example, plants like fiber, they're not absorbed. They're not absorbed throughout your small intestine. They get to your colon, and that's where they are broken down by your gut bacteria. And that process is called fermentation when they break it down into gas. Oligosaccharides, so wheat, rye, onions, garlic, legumes, right? Disaccharides, so dairy, so milk, cheeses, especially soft cheeses, yogurt. Monosaccharides, honey, apples, and high fructose corn syrup. So fructose there is the big trigger. And polyols, which are found in some fruit, vegetables, and artificial sweeteners, right? So like in a lot of gums and, weight loss products. So these categories of foods really seem to produce a lot of gas, bloating, and again, like either diarrhea or constipation, again, symptoms that fall into this IBS category. So for IBS, there's this elimination of these FODMAPs, right? So you remove all the high FODMAP foods, you minimize them, then you do that for 2 to 6 weeks. You have to really make sure you're not doing it for over, the recommended amount of time, as it can be very depleting to your microbiome. You're obviously getting rid of a lot of good, foods. Like, right, we just talked about fruits, vegetables, all these like really healthy foods. And then you reintroduce them, right? So you come up with a plan where you gradually add these foods back to identify the triggers. And then the next stage is personalization. So you actually determine safe foods and then you integrate them into daily life to reduce IBS symptoms. So why are we talking about this? We're talking about SIBO, right? So in SIBO, you have to remember SIBO is a journey, and successful treatment is really made up of phases. So usually the first step, phase 1, is going to be eradication or induction treatment. You want to get rid of the overgrowth, like we just talked about, for example, with antibiotics. And then phase 2 is maintenance, right? And maintenance, you want to focus on motility and preserving the changes you've made during the eradication phase. And that's where you add things like diet. That's where diet plays a big role. Low fermentation diet, right? So another diet that again can really come into play during phase 2. Developed by Dr. Mark Pimentel and Dr. Ali Reze, LFE supports a balanced microbiome by reducing fermented foods, which can help patients with SIBO and IBS, right? So again, you're restricting carbohydrates, you're limiting high carb foods to prevent the gut bacteria from fermenting them into gases, right? Like we talked about hydrogen, methane, hydrogen sulfide. Then there's this concept of meal timing. That is so important, right? If you space your meals 4 to 5 hours apart, this supports the gut cleaning waves called MMCs, migrating motor complexes. And that is absolutely essential for a healthy digestive system. So what do? You want to avoid sugar substitutes, sucralose, sorbitol, xylitol, mannitol, stevia. And then you also want to minimize high fiber and inulin-rich foods, lentils, beans, soy, dairy. And like we just spoke about, you really want to preserve, it's called the housekeeping wave. And after someone is fasting for that 4 to 5 hours, you have this beautiful wave of motility from that starts high up in your gut, basically right after the stomach, and it moves everything forward in your small intestine. And so, as you can imagine, this is absolutely key to SIBO and feeling really good and having that like light, clean feeling in your gut. Everything has been moved forward. Elemental diet. So this is a eradication diet. This is a phase 1 induction treatment that I have actually used more and more thanks to the availability of better elemental diets like M biota, which tastes amazing considering the previous ones did not. So elemental diet is basically replacing all your food with a simple shake. And the recommended timing is 2 weeks. So it is not a depleting treatment. The diet is actually, it has calories, like each packet of the M-Biota, for example, has 300 calories, and it is full of amino acids. You've got all the vitamins in there. So it's actually a very nourishing and nutritious way to eat, but of course it's difficult. But it has so many benefits. So you can see here in this chart, right? There's no food additives, right? So you're getting rid of so many chemicals that are found in everyday food, right? There's low fat content. It's absorbed proximally, right? So lowers the fecal bulk. It's allergen free, right? So elemental diet has been very well studied for conditions like EOE, eosinophilic esophagitis, for inflammatory bowel disease, mostly Crohn's specifically. So this is a very well studied approach in many GI conditions. You're not, you're decreasing the pancreatic biliary stimulation, right? For people who have chronic pancreatitis, you're improving gut mucosal permeability. So there is, what we talked about before, leaky gut, right? So you actually help seal up that junction between what's in your gut and what's in the wall of your gut wall. And so that is helpful. And then, of course, like I mentioned, complete micro macronutrient content. And this helps for optimal absorption efficacy. So I think that now that we have a more palatable option, I think that with the proper support, because you definitely do need support, you definitely want to do this, in close contact with your gastroenterologist. I usually check in with people multiple times, but it has had really incredible results. I think in hydrogen SIBO, the last research shows 100% eradication with M-Biota diet. Okay, so we are going to move on to a little Q&A. So thank you everybody for submitting some really, really interesting questions. So unfortunately, we can't get to all of them, but we are going to address a couple that were really fascinating that kept coming up. So hopefully this addresses some of your questions. So number one, does Candibactin really work for SIBO? So Candibactin, that's Candibactin AR, Candibactin BR. These are herbal blends. Candibactin AR stands for aromatic, basically aromatic oils. It's mostly oregano oil, and Candibactin BR stands for basically berberine. It's mostly berberine with a couple other herbs. And there's actually a study looking at using these herbal combinations in SIBO. This was done at Johns Hopkins, and the results were pretty promising. Now, of course, supplements and herbal supplements like Candibactin are not FDA approved. So you may have more unpredictable results. And of course, you always have to be so mindful of your liver when you are taking combinations of herbs like this. So the main, the main take home point is you have to find a practitioner who's going to work with you to understand your, basically how you want to be treated. If you'd like to avoid antibiotics and see if there's another option, then have somebody on your team who can talk to you about elemental diet, can talk to you about Candibactin and all of the different oils and herbs that can be, that have been studied to be helpful. And so you can come up with a really, thorough, holistic, comprehensive plan to treat your SIBO. But again, don't do it on your own. it is a very difficult road to navigate and again can be dangerous. So make sure you are on board with, a team that you trust and have a good plan with. Number two, can a person have small intestinal fungal overgrowth? So this is SIFO. So this is something that is being studied more and more. Just at our last Digestive Disease Week, our academic conference, we talked about SIFO, and we're starting to really understand some of the risk factors of SIFO. But I think the basics for people to know are that SIFO is real. Small intestinal fungal overgrowth is an overgrowth of fungus in your intestine. Most commonly, it's a type of candida. There are some already very well-known risk factors that have been published by doctors like Satish Rao. For example, PPIs, dysmotility, to name a few. And there are, again, both natural and medical antifungals that, you can talk to your practitioner about for treatment. So really, 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 interesting new topic. But again, a lot of microbiome conditions are going to be coming out in the next couple of years. Can having SIBO make your stool change its color? Well, I brought my little stool mug to show everybody how much I love talking about stool. I do talk about it all day. But first you want to kind of understand what is your normal, and then you want to understand what is abnormal for you. And one of the first things I always say is always take pictures, because pictures are worth a million words, right? So bring your pictures to your doctor and be like, what is going on here? And really be able to talk about your stool, especially if it's changed. That could be, that can really signify something specific. So, of course, there's one of the biggest things you talk about is the consistency, right? So we use this chart called the scale called the Bristol stool scale from 1 to 7. Basically, 1 is very constipated pellets, 4 is kind of our perfect banana, and 7 is water. And so you want to be able to talk about the consistency. You want to be able to talk about the frequency. You want to be able to talk about the color, right? Obviously, we know that normal stool is kind of a brown, green, usually combination. It can be darker, it can be lighter, depending on what you eat. But there is a little variety there. But obviously, if you are getting pale colored stools, obviously black stools, if you're seeing blood in your stools, like there are a lot of markers that are not to be ignored. So if you are having those types of stools, changes, you really need to tell your doctor. There is not specifically a connection of SIBO having a specific stool color, but what about smell, right? So smell can definitely tell you a lot about about your stool and about, a healthy microbiome, for example. And so one thing that comes up over and over is this connection of having like a sulfur odor, so kind of like a rotten egg odor to your stool. And it is a very putrid smell. It's not pleasant, but it is very specific. So I will definitely have patients who are like, I have this insane smell of sulfur that is new after X exposure to their gut, right? And things change. Now I have diarrhea. Now I have, now it smells like sulfur. And so these are the things you really need to take note of, because again, they can really help you understand what's going on, right? So then you can be talking to your practitioner. Okay, sounds like you need the Trio Smart. You need a SIBO test. This sounds like ISO, and it can get you to where you want to be in your journey to get some answers. Okay, number 4, we've got which probiotics do you need for SIBO? Someone asked. Okay, so this is a little bit of a controversial area where a lot of people do ask me, okay, what probiotic should I take? But think about what SIBO is. SIBO is an overgrowth of bacteria. So the idea of taking these capsules full of millions of CFUs of live bacteria, most people do not feel good taking probiotics. And in fact, Satish Rao has has actually published papers showing that there can be, adverse effects if you have SIBO and you are taking probiotics. So I hear this a ton in practice. Most people, it's actually almost like a clue to me that that's what's going on, that it's SIBO, because they say, I was a little bloated, a little diarrhea, then I took, X probiotic off the shelf, and suddenly everything was worse. And I had brain fog, and, things were so much worse. So again, try not, I know all the marketing is pretty and it's out there, but try not to just go to the shelf and pick out, any probiotic and any kind of self-treatment. Try to get yourself an answer to exactly what's going on, and then treat it in a personalized, specific way, and then you'll get the best outcome. So probiotics definitely can be used later for gut optimization. Then you can talk to your doctor about the best way to optimize and build back a really healthy microbiome. But while you actually have SIBO, it is rare, although I will say there are a couple studies that have been looked at, but in general, right now, it is rare for probiotics to be helpful. And then finally, how can I learn more about the 3 gas breath test Trio Smart, or ask a question that wasn't answered in this webinar tonight? So you can go to triosmartbreath.com, and you can also, of course, email support@triosmartbreath.com, right? So the contact form is on the website, and they have an amazing support team. So if you have questions, definitely reach out. Okay, so an exciting part of the evening here. So there's a book giveaway, right? So you enter to win. 2 lucky winners will be chosen. So you use this QR code, and actually the winners are going to be announced after the webinar via email. So you will hear very soon if you are the lucky winner. This is a great book. I have read it cover to cover. And then, even possibly more exciting, here we go. We've got a promo code. So you can save $50 off of the Trio Smart Breath Test. So free shipping. And so here again, you can use this specific promo code. This is available for online orders at triosmartbreath.com, right? And this is up until September 30th. And then finally, that's me. So you can always feel free to reach out to talk to me one-on-one. I see patients in New York and Connecticut. My medical license is in New York and Connecticut, but I also provide educational sessions actually all around the world, helping people find the root cause, and get answers and actually get healed. Okay. And so finally, I think that, it's really difficult sometimes to get answers. I think a lot of people really struggle for years trying to figure out what's going on, deal with medical gaslighting. A lot of, it's in your head, or, it's normal to be bloated, or you're just getting old. I mean, I've heard so many different, things from patients that are so frustrating. And so, people are on journeys for years. And it doesn't have to be like that. You need to work with someone. You need to find the right tests. You need to get your answer, and then you need to treat it. And you can completely transform your gut health and transform your life. So thank you for joining us. Again, yeah, thanks so much.